It's time again for Health Monitor, the number one program that's so to health, to live a life in its healthiest way, to improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the number one health show, yeah.
This is Health Monitor, your guide to good health. My name is Jibe Ologe. As usual, we have our regular segments on the show. We have assisted conception, body care, and health tips coming your way today on Health Monitor, your guide to good health after this time out.
It's Health Monitor, the number one health show.
Molfix pants with anatomic fit technology. New Molfix pants, inspired by babies.
Yeah, welcome back to the show. This is assisted conception, and Dr. Ivy is standing by to take that part of the show where she's going to be talking to you on how to assist you to conceive in case you're finding it to conceive naturally. Hello, good day, viewers. You are welcome to the assisted conception part of the show. I am Dr. Omori Ivie from True Care Fertility Clinic. So today I'm going to be talking about infertility. What is infertility? What are the causes and how do you go about it for those who suffer from infertility? So what is infertility? Infertility is the inability to achieve conception in a heterosexual couple despite adequate sexual intercourse of at least 3 to 5 times in a week and of 1 year duration. So if you're heterosexual and you've not been able to achieve pregnancy in 1 year duration, despite adequate sexual intercourse of at least 3 times a week, then there is a problem, meaning there's infertility. So infertility can be caused by male factor, female factor, and of course both of both of them can have the problem. But today I'm going to be dwelling on female factor infertility. So what are the things that can cause infertility in a female? First of all, I want you to know that there are 3 major parts of the upper reproductive tract of the woman that can assist us in achieving conception. 1 is the ovary, and 2, you have the uterus, which is the womb, and also you have your fallopian tubes. These 3 parts are vital in achieving pregnancy. Of course, they are the higher centers, but I'm going to dwell on these 3 parts. So, what is the function of the ovary, what is the function of the womb, and what is the function of the fallopian tube? Understanding the function will make us understand the cause of infertility and what may affect these parts. So, the ovary is a storehouse for a woman's egg. So, once a woman is born, her eggs are stored in the ovaries. So, every month she goes there, release an egg, which is what we call ovulation. So for a woman who has a regular 28-day cycle, she will ovulate on the 14th day of her cycle. So when she ovulates, the spermatozoa will move from the vagina to the womb, then through the fallopian tube, and the egg that was ovulated moves into the fallopian tube, and the egg gets fertilized now by the spermatozoa, meaning that the spermatozoa will fertilize the egg in the fallopian tube. The resulting embryo will move back to the womb to attach. So meaning that the ovary is the storehouse for the eggs, the fallopian tube is a passage, and of course the meeting point for the spermatozoa and the egg. Then the uterus, which is the womb, is where the baby will reside. So it's the house of the baby. meaning that after the embryo moves to the uterus, attaches to the uterus, to the womb, and grows there till 9 months, and when the woman, and that's when the woman will deliver the baby. So, meaning that anything that will affect the ovary, the fallopian tube, and of course the uterus will result in infertility. I will start from the fallopian tube because tuber blockage is the commonest cause of infertility in our environment. So anything that will result in fallopian tubes being blocked will result in infertility. So what can cause the fallopian tubes to be blocked? And remember, the fallopian tube is a narrow passage, very narrow, so it can easily get blocked. So tuber blockage can be from what we call sexually transmitted infection, STIs. The common one you have causing tuber blockage is gonorrhea and chlamydia. Most times when a woman has gonorrhea or chlamydia, she may not present with any symptom, meaning that she may not know that she has either of those, chlamydia or gonorrhea. Unlike a man, when a man has gonorrhea, he has painful urination, and of course that will prompt him to go to his doctor. But a woman, on the other hand, may not have any symptoms. She may not know she has this disease. And once she has chlamydia and gonorrhea, and if it's untreated, it can result in blocking the fallopian tube. And once the tubes are blocked, there's no passageway, and there's no way the egg can communicate with the spermatozoa. That will result in infertility. Another cause of tuber blockage is surgery. Surgeries like myomectomy, which is fibroid removal. Then you also have septic appendicitis because of the proximity of the appendix to the fallopian tube. So when it's septic, meaning there's already an infection, it can result in tuber blockage. You also have endometriosis. In endometriosis simply means that the lining of the womb, which is the one a woman sheds every month as menstruation, the lining of the womb goes to another place and deposits. And the commonest part you have it is in the ovary. So you can have it in the fallopian tube as well. Once the lining of the womb is present in the fallopian tube or in the ovary or outside of the womb, this is called endometriosis. And women with this, most times will present with painful menstruation. So once a woman has endometriosis, this can lead to scarring. You know, when you cut yourself, you can have scarring of the fallopian tube. That's when you have a scar inside of the fallopian tube now, and this will lead to blockage of that fallopian tube. So endometriosis can cause tuber blockage. And of course, when there's tuber blockage, there's no communication between the spermatozoa and the oocyte as egg of a woman. And of course, there won't be pregnancy. Another cause of tuber blockage is tuberculosis. But in the case of tuberculosis, it destroys the function of the womb. So anything that will affect the fallopian tube of a woman will result in infertility. And of course, the commonest cause of tuber blockage remains infection, which is sexually transmitted infection. And also you have pelvic inflammatory disease as well. These can cause tuber blockage and result in infertility. So, having talked about the tubes, the fallopian tubes, the next thing I'm going to talk about is the ovary. Ovary of a woman is where the eggs are stored. Once a woman is born, we have a fixed number of eggs in our ovary. And of course, as we grow older, we release these eggs, we ovulate, and number diminishes. That's why we have menopause. So anything that will make a woman not to ovulate or anything that will affect the ovary will result in infertility in a woman. So causes of anovulation or ovarian problems, we have polycystic ovarian syndrome. Women who have polycystic ovarian syndrome usually have irregular menses. They have anovulation, meaning they will not ovulate, and this will also result in subfertility or infertility. They may have delay in conception. Remember, we said after adequate sexual intercourse of at least 3 times a week and 1 year duration, and a woman is not pregnant, a couple don't get pregnant, of course, you term it infertility. So women with polycystic ovarian syndrome, they do not ovulate frequently. And of course, if they don't ovulate frequently, pregnancy is also delayed or difficult. And these women will tend to have infertility or subfertility. Having talked about the tuber causes of infertility, that I've talked about things that can cause tuber blockage and can result in loss of function of the fallopian tube. I would love to continue today, but we have time constraints. And also remember to keep safe. We are in very difficult times. Remember to obey the authorities, use your face mask, wash your hands regularly, or sanitize with alcohol-based sanitizer. We have preventive measures at True Care Fertility Clinic. So we have hand sanitizer at every point in the clinic. So you can also enjoy this when you come to the clinic. Don't be afraid of transmission of coronavirus. We respect the social distancing rule at the clinic. You have hand sanitizer everywhere, and you have the facility to wash your hands as well. So don't be afraid. Come to True Care Fertility Clinic today and have your family completed. Thank you very much, and God bless you.
Thank you, Dr. Ivy from True Care Fertility Clinics, for that incisive information on how to conceive. And in case you cannot conceive naturally, please call Dr. Ivy. She will give you information on how to assist you to conceive. We want to take a break now, and Help Monitor will be right back.
It's Help Monitor, the #1 health show.
Memories are created daily from events, photo, and video shoots. Having the perfect studio, equipment, and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo, and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Akme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
It's Help Monitor, the #1 health show.
Yeah, welcome back to Help Monitor Your Guide to Good Health. This is the body care part of the show. We have a new doctor we're introducing today on body care. His name is Dr. Joe. Dr. Joe is going to be talking to you on who is at risk of COVID-19 or coronavirus. So you better listen to him. If you have any of these conditions, that means you're at risk and you have to prevent yourself and stay safe. So Dr. Joe, over to you right now.
So question one is, who is actually at risk as far as the coronavirus is concerned? Well, this is a very good question, because as the virus gets nearer home, as it gets closer to a place of abode, it focuses the mind. So it makes sense to know who is actually at risk. So who is at risk? Well, everybody is actually at risk. Okay, that's the first thing you need to know. Everyone is at risk. However, some people are more at risk. And by the way, this is not to scare anybody. The whole idea is not to scare anyone. The idea here is that if you are more at risk, then you have to take steps to actually protect yourself a little bit more. Okay, so that's the whole idea behind the answer that I'm going to give. So I'm not trying to scare anybody. I'm just trying to give you statement of facts based on what's been happening in China and Italy and elsewhere. Okay, so who is more at risk? Well, smokers. Okay, now if you are a smoker, then this would be one good reason for you to actually give up the habit. The reason for this is that the virus is actually attracted to a particular cell in our lungs, and if you're a smoker, then you make that cell readily more acceptable to the virus, so the virus is going to attach a little bit much more easily. So if you're a smoker, you are at a higher risk. Who else? Well, people who've got diabetes, whether it's type 1 or type 2, they are at risk. Who else? Those who've got high blood pressure, they've been found to be severely affected as well, with information coming from China and Italy. Who else? Well, if you've got kidney disease, there is a very strong likelihood that if you've got kidney disease, you're probably going to have high blood pressure anyway. So they tend to go together. So you are at risk. Who else? Those who have got chronic pulmonary disease, chronic lung disease. So COPD, chronic obstructive pulmonary disease, they are actually at risk. And for the same reason as it applies to smokers. So if you've got COPD, chronic lung disease, then it will make sense for you to actually take vital steps to protect yourself a little bit more. So who else is more at risk? Well, anyone who's got compromised immunity, either because they've been prescribed steroids by their doctors, so they're using steroids in the long term, or they've got HIV, or they've got cancer. This group of people tend to have compromised immunity, so they need to take extra precautions. Who else? Well, the next group of people I'm going to talk about have had a disproportionate case fatality, and I'm referring to the elderly, the over 70s, and the data coming from China and Italy is that the older you are, so those who are over 80, the case fatality there seems to be a little bit higher. So the elderly, those over 70s, in particular those over 80, they need to take extra precautions as well.
I want to appreciate you, Dr. Joe, for taking us through that part of the show, talking to us on who is at risk of COVID-19. Okay, I want to go for a break now. When we come back, Health Monitor will continue.
The state government is gradually easing the lockdown to allow for minimal movement.
As responsible citizens, we also have our roles to play
in ensuring a safe and secure society.
I would like to encourage you to be sensitive, cautious,
and on guard for your personal state of well-being and others.
Please stay at home if it is not necessary for you to go out.
And if it is important for you to go out,
kindly protect yourselves
by observing social distancing.
Also washing your hands regularly, especially if it's a public place.
And take your bath before relating with members of your family.
Don't forget to use your alcoholic-based sanitizer.
Avoid sharing of utensils with friends and even family members.
Make sure you take warm water regularly to keep your body warm.
Stay safe, stay at home, keep the rules.
We appreciate the immense contributions of our frontline medical personnel to minimize the casualty figures during this pandemic, while our hearts go out to those who have lost loved ones.
Join the force to beat this pandemic.
This message is brought to you by Electronic Media Content Owners Association of Nigeria, EMCON.
You're welcome back to Health Monitor, your guide to good health. This is the part where we give you health tips. And today we're looking at fruits and vegetables and pesticides.
Fruits and vegetables are among the healthiest foods on the planet. They come with vitamins, minerals and pesticides. Yes, unfortunately, that's the harsh reality. Almost 99% of the crops are treated with chemical pesticides. The residue of these pesticides is present on the fruits and vegetables when you buy them in the grocery store. The most shocking part is that even after washing these fruits and vegetables for continuously 15 seconds in running tap water does not remove the chemical residue. In the past decade or so, there has been a tremendous increase in the use of chemical pesticides to meet the needs of overgrowing population. Eating fruits and vegetables without properly removing the pesticide residue may lead to food poisoning, diarrhea, hormonal issues, skin and hair problems, and even long-term deadly diseases of brain, kidney, lung and cancer. Almost every crop today is treated with chemical pesticides. Now, before I come to the solution, let me just quickly share with you what and how this is done. So basically, there are three types of chemical agents used on fruits and vegetables to bring out what actually you see at the grocery store. First, the ripening agents. Fruits like banana and mangoes are treated with ripening agents, mostly calcium carbide. Obviously, this is done so that fruits and vegetables reach the market before season and can fetch more profit. The problem with industrial calcium carbide is that it contains heavy metals like lead and arsenic, which are dangerous for the human body. Secondly, coating agents like wax and DPA are used mostly on fruits like apples, grapes, and almost every exotic fruits which travel the 7 seas to reach your doorstep. The purpose of doing this is to preserve the moisture and the consistency of the fruits during cold storage and transportation so that they look fresh on the shelf. First, never eat fruits and vegetables which are not in season. Secondly, ditch all the foreign exotic fruits and vegetables and switch to local produce. Now coming to third chemical agents which are worst of all are the pesticides. There are systematic pesticides which are put in the bottom of the tree nearer to the roots so that they are absorbed by the plant, and they will be in the leaves, stems, fruits, flowers for about 10 to 15 weeks. Then there are contact pesticides which are sprayed on the surface of the plant, fruits and vegetables. These are the main culprits as the residue of these pesticides remain on the fruits and vegetables even after you bring them to your home. But we can get rid of them. Now the most obvious solution is to buy organic food. Although it's not that organic foods are not treated with pesticides, it's just that they use safer alternatives. So let me share with you a very simple way which has been proven to remove almost 98% of pesticide residue. Yes, all you need to do is put the contaminated fruits and vegetables in one place in a container and pour enough water in it. Now put 1 tablespoon of baking soda in it. Baking soda is easily available in grocery shops. I have even linked it down in the description box. Now leave the container for about 15 to 20 minutes. Now wash them thoroughly with running tap water. Baking soda, that is sodium bicarbonate, known for its alkalizing nature, helps remove almost 98% of the pesticide residue from fruits and vegetables. This is an easy yet very effective way of removing pesticides from fruits and vegetables. There are some more tricks which help you minimize the effect of pesticides. For example, whenever you want to wash something like cabbage or onions, always make it a habit to peel off the first layer, then wash them in baking soda solution. Then if a fruit or vegetable has skin which you won't be using, even then do not shy away from washing it with baking soda. For example, when you cut an unwashed muskmelon, some part of the pesticide residue from the surface goes inside. Next, in order to diminish the effect of systematic pesticides, it is recommended to keep the lid open while cooking the vegetables. The agricultural scientists say that with steam, pesticides inside and outside the body of vegetables move upwards. Well, it can't be said that using all these practices we can make our fruits and vegetables 100% free of pesticides.
So that is it today on Health Tips, talking about fruits, vegetables and pesticides. So make sure your fruits and vegetables are grown without pesticides and grow them organically. All right, thank you very much for being with us on this part of Health Tips. We want to take a break now, and Health Monitor will definitely continue.
It's Health Monitor, the #1 health show.
Memories are created daily from events, photo and video shoots. Having the perfect studio, equipment and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Acme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
That was Health Monitor for you again today. We want to appreciate you for spending this precious time with us. We want to also appreciate Dr. Ivy, who came on the behalf of True Care Fertility Clinics. Not forgetting Dr. Joe, who brought us Body Care. And Body Care today, Dr. Joe talked to us on who is at risk of COVID-19. I want to thank my producers for bringing us that piece on fruits, vegetables, and pesticides. Thank you for being with us. I want to catch you again on Health Monitor, your guide to good health.